Hello my health happy friends, it's Dr. Tom Micklewright here today, answering the question, how do you stop having headaches every day? And how do you know when it's something serious? This is a problem I see all the time as a doctor working in the NHS in the UK. I come across patients who are experiencing frequent headaches, and despite taking paracetamol, ibuprofen, or a combination of the two, they just can't seem to stop the headaches. And after a while, it's not even the headaches that are the most worrying thing. After speaking to friends and family and maybe Googling online, the bigger question starts to become, could this be something serious? In my consultation room, I have just 10 minutes to try and solve the problem, and that's not usually enough time. But in the majority of cases, I find when people start putting into place the 5 things we're going to discuss today, they experience a huge amount of relief over their symptoms. And for many of them, knowing those 5 things is enough to stop the headaches for good. What's important to know though, from the off, is that although headaches can rarely have a more serious underlying cause, a recurring headache in itself doesn't necessarily mean something serious is going on. Lots of common benign things also cause a recurring headache. We will go through some of the warning signs for some of the more serious causes of headache at the end of the video, so make sure you stay tuned for that. But the vast majority of headaches are caused by 2 benign conditions: tension headache and migraine. Tension headaches cause that typical sensation of our head being in a vice, that feeling of a tight band being wrapped around our head or our temples. Tension headaches can be episodic, or they can be constant or recurring, but they're not caused by anything going on inside of our heads. Tension headache instead is caused by stress and tension in the muscles around the outside of the scalp. By contrast, migraines do arise from inside of our heads. No one's completely sure as to how they develop or why, but the current thinking is that part of our brain, the hypothalamus, triggers a wave of electrical activity across our nerves that spreads around the outside of our brain. This triggers different chemicals to be released that cause a hypersensitivity across the brain and the nerves, and causes spasm of the blood vessels in the brain. These 2 things, the hypersensitivity and the spasm of the blood vessels, is thought to cause that typical pattern of symptoms we see in migraine. That is the headache, nausea and vomiting, sensitivity to light or sound, and also for many people, an aura or visual changes that happen in the hour before the headache starts. For instance, flashes of light or zigzagging lines in the vision. Outside of these 2, there are so many other causes of headache, and you can find loads of lists and description of these online. But what you need to know is how you can stop a recurring everyday headache regardless of the cause. And these 5 things will help you do just that. Step number 1, take a look at your lifestyle. And in particular, I want you to take a look at sleep, stress, hydration, and caffeine. Sleep deprivation is a common trigger for migraines. So if you're not getting 7 to 8 hours of sleep a night, that may well in itself explain why you're getting everyday headaches. In addition to that, think about your stress levels. Stress can be a trigger for migraine, but also for tension headaches. Think about that typical image of the person with headaches kind of staring at a screen with a furrowed brow, and you can imagine how the muscles around the scalp are really going to be held in tension and going to be contributing towards a headache. The third bit of lifestyle to look at is your hydration. Now, the guidance is we should all be looking for 6 to 8 glasses of water a day. That's what we should be aiming to drink each day. But in reality, it's very hard to do, and loads of people struggle to do it. But dehydration is a common cause of headache, so aim for those 6 to 8 glasses and see if that impacts the headache. And then finally, caffeine. Caffeine is actually a diuretic, so it makes you want to wee. So if you're kind of thinking, well, I do have 8 cups of water in my tea, actually the reality is you're probably not retaining as much of that water as you think you are. What's more, for some people, caffeine can also be a trigger for migraines. So the recommendation is if you're drinking a lot of caffeine, especially if it's instead of water, if you're predominantly having tea or coffee, try and reduce this and see if it makes an impact on the headaches. However, just be aware that caffeine withdrawal can also cause a headache. So if you're having kind of 7 or 8 lattes a day, don't just suddenly knock it on the head, because that's likely to bring on a headache in itself. Aim to slowly reduce over time, and that way you'll get the benefits from reducing your caffeine without causing a headache yourself. The second step to look at is identify exactly where the pain's coming from, because there may well be clues in that. If you're getting a lot of pain at the back of your head, especially when you're moving your head or in certain postures, it may well be coming from the neck, and the muscles of the neck attach quite high up to the back of the scalp. So we often see neck sprain manifest as headaches, particularly at the back of the head. If you're finding that the headache is worse when you're staring at screens or reading, visit an optician in case the problem is eye strain. Does your jaw click or pop when you're chewing food? If it does, the problem may be coming from your jaw joint, and that's causing pain that's spreading up from the jaw and around the head. And also, are you noticing, as well as the headache, you've constantly got a runny nose or a congested nose, or the pain's a lot worse when you're bending forward? These could be signs of sinusitis, an inflammation of the air passages around the face and inside the bone. If those become inflamed, that can also cause a headache, typically around the cheeks, feeling in the back of the eyes or across the forehead. If that sounds like you, visit a pharmacist who can give you some medication specifically to treat sinusitis. Number 3, check your medication. The evidence seems to suggest that paracetamol on its own isn't much more effective than placebo at treating headaches. Far better is ibuprofen. Also, you know I said caffeine sometimes can be a trigger for headaches? Well, the evidence also shows that caffeine added to ibuprofen seems to be best for managing headache-related pain. So whether that's taking an ibuprofen tablet and a cup of coffee, or a tablet that contains both, that's a very effective way at treating a broad range of headache causes. That said, because nothing is ever simple in medicine, be aware that painkillers can also cause headache. That's right, painkillers can cause pain. Now, this tends to be more relevant if you've been having headaches or another pain condition for a long time, and you've been using painkillers for about half the number of days in the month, so 15 out of every 30 days. Or if you're using codeine or other morphine-based painkillers, taking these for just 10 days each month can be enough to cause a headache. This type of headache, called medication overuse headache, is really problematic to treat, and the truth is the only way to address it is to go cold turkey on your pain medication. Now, don't do this without discussing with your healthcare team if you're on prescribed painkillers. I don't advocate any changes to medication just on a YouTube video. But if you've been trying to manage your headaches for a while now yourself, and perhaps for a couple of months you've been chomping on paracetamol and ibuprofen most days in the month, consider whether those ongoing painkillers are actually contributing towards your headaches. Number 4, check your home, and in particular, check your carbon monoxide alarm. Carbon monoxide poisoning is a silent killer and also a cause for headaches. So if you're getting a lot of headaches, especially in the morning or when you're spending protracted periods of time at home, make sure you get a carbon monoxide alarm if you haven't already, and if you do, check that it's working and that it has batteries. And number 5, if the other 4 things haven't helped by now, chances are you're going to need to go to a healthcare professional in order to get diagnosed. But what will really help you and them come to a diagnosis is a headache diary. This is basically a record where you can record when you started with a headache, what time, how bad it was, whether you're getting any other symptoms, and what the possible triggers were, or what were you doing at the time the headache came on. All of these can help you identify patterns in the headache that can help you get to a diagnosis. For instance, if the headache is always worse at the same point in your menstrual cycle, it may well be hormonal related. If you always get the headaches when you're at work or staring at a screen, it could be eye related. If you're always getting it after certain meals, like when you've eaten cheese or chocolate, those things can be trigger for migraines. So keeping a record can A, help you identify triggers for you to exclude and see if they benefit your headaches, and B, provide more information for your healthcare team to reach a conclusive diagnosis and decide if they need to investigate you further or try some prescription medication instead. So now you have your 5 things that you can try now to stop getting headaches every single day. But there are some serious causes of headaches, and one of the difficult things is knowing when you should get help and when you should start to be worried. Now, although recurring headaches in themselves don't mean that there's a serious underlying cause, if these headaches are evolving over time, so if they're gradually getting worse over days or weeks, then that is a serious sign, and that should prompt you to speak to a healthcare professional. Also, if the headaches come on suddenly, and by suddenly, I mean reaching their peak intensity within 5 minutes of onset, that also should be a sign to get yourself checked. Although nausea and vomiting are associated with a lot of headaches, especially migraine, if you're waking up every morning with a headache and feeling nauseous or vomiting each morning, that can be a worrying sign. And finally, if you're getting your headaches in combination with any other unusual new symptoms, including a fever or rash, dizziness, jaw cramping, or numbness or weakness affecting your arms or your legs, those are serious signs that should prompt you to get yourself checked out. That's it then for today's video. Just to recap, we discussed 5 things that you can be doing to stop getting a headache every single day. They are: have a look at your lifestyle, in particular sleep, stress, hydration, and caffeine. 2, isolate the pain and make sure it's definitely coming from the head, and see if any of the other common nearby structures might be contributing towards the headache. Number 3, check your medication. Make sure you're using the best medication for pain relief, and make sure that you're not using too much. 4, check out your home, and in particular your carbon monoxide alarm. And number 5, keep a record of your symptoms and any potential triggers. They will help you find the things you need to avoid that could be triggering a headache, and provide more information for your healthcare team. If you enjoyed today's video, please don't forget to hit like and subscribe, and to share the video with your friends and family. I want to build a community of people that want to take a more proactive stance when it comes to their healthcare. So this channel will be discussing more how-to tips, ways to live more healthier lives, and some of the gadgets, tools, and products out there that can also help you live a more healthy life. So if you want to be part of that, please join the community, and I hope to see you on the next video.